Cleveland Clinic is always ranked among the very best medical centers in America. In your specialty, cardiac care, it has been number one for the past 15 years every year. And by some measures, it is also the most efficient of the top-ranked medical centers. How do you manage to do that?
Well, it's interesting that I think most people don't realize that we are organized in a very different way. There are very few hospitals that are organized the way we are. First of all of us are employed. We all have salaries. We have, so it doesn't make any difference. Let's say if I was a cardiac surgeon, whether I did 2 heart operations a day or 4, I took home the same amount of money at the end of the week. Right. So there's no incentive for us to do extra something or others or extra tests or any of that sort of stuff. Right. The second thing is that we all have 1-year contracts, and we have annual professional reviews. And so the quality of the doctors is controlled, and so there's no tenure, and if you don't make it, you don't get either a pay raise or you may not stay. So that probably is one of the most important things that we do. Is really quite different from most places where doctors come and they can practice for as long as they want to practice. The other thing is, interestingly, we're physician-led, which is really quite different from most organizations, which has an administrator running the hospital, the doctor group, and maybe a dean running the medical school. This is much more like a corporation, and the CEO, in this case, is a doctor.
Now, how do you get the best doctors in the world to come work for a salary?
I think that's a really, it's a great question, and I've been asked that question multiple times, but I think it's the environment that doctors come to work in. They come to work in a place where they've got colleagues, and they have colleagues that they respect, and they are supported, and so they can do doctor work. I mean, most of us didn't sign up to fill out insurance forms. We signed up to try and look after people, and the wonderful thing that I found when I went there is I had incredible support. And I didn't have to do the mundane things about go and find the x-ray. Right. I had all the supports to do that sort of thing, and I've never sent a bill. Right. It's all done for me. So I did doctor work, and I think that's what most doctors want to do. Interestingly, there's an interesting thing going on amongst physicians right now. Only 10% of the doctors under 40 in the United States go into practice by themselves or another colleague. They're either in groups or employed. Right. And I think there's good reasons for that. One, the business of practicing medicine has gotten tougher. The body of knowledge you've got to surround makes it very hard for you to look after an individual without having colleagues to help you with their knowledge. And, there's a lot of things that are coming down in terms of quality, in terms of contracting, et cetera. So I think increasingly physicians are going to move in employed or associated groups.
The Cleveland Clinic is not for profit. Is that model the future for big healthcare institutions?
Well, there are a lot of very successful for-profit hospitals that run business-wise very well. I think that we are becoming increasingly savvy on how we run the business and driving out the inefficiencies. But I think what we're going to see in healthcare is I think you're going to see a roll-up of hospitals. I don't think it's any more reasonable to think that each hospital can be independent. Have its own financial support, its own purchasing, its own back office for all these sort of things. And you need to get the efficiency. And so you need to have hospitals come together in systems. And that will begin to eliminate the duplication. I mean, you cannot expect every hospital to do great heart surgery or to put probes in people's brains for Parkinson's disease with pacemakers attached to them. I mean, it's too high tech. And so what we have seen is trying to build, at the clinic, we're trying to build a healthcare delivery system for the 21st century so that there'll be family health centers where you go and you get your flu shots and your checkup and your mammograms and those sort of things. You got a problem, you go to our community hospitals where the babies are delivered and your gallbladder is taken out and the hernia is fixed and the pneumonias are taken care of. And then you have at the center of this a very high-tech hospital that looks after the really tough stuff. So you need to move the patient to the right place for the right care at the right time.